Thanks for joining us tonight. To help us get this conversation started, I'd like to welcome two guests to the table to begin with, and we'll do introductions first. Dr. Saeed Kajusta, Associate Network Director for Behavioral Medicine, SSM Healthcare, St. Joseph's Health Center, and also Dr. Anjan Bhattacharya, Division Director of Adult Psychiatry at St. Louis University. There's a lot of titles, but that also means you're well qualified for this discussion, so I appreciate you being here. Let's start broadly, if we could. What is the impact to the larger community when it comes to mental health? Maybe a better way of saying that is, why should I care if I myself am at home watching and don't currently have a mental health issue I'm dealing with?
I always say that mental health issues are things that don't discriminate. You can find it in the person in the highest office and any ordinary people who are walking on the street. It is part of everyday life of all of us Americans, and we have to deal with it one way or the other. Now, if we are dealing with that face-to-face, great, but majority of the time, as we all know, clinicians, it gets ignored or it gets untreated. But it is a reality of life every day, and in the light of a lot of issues that have been going on recently in St. Louis Metropolitan and in the nation, we'll see that mental health issues are coming to the forefront of health of the community altogether.
I would agree with Dr. Kajusta. I think nobody's immune to these kinds of problems, and the other thing is we may not think that the people around us or our loved ones are suffering, but many times these are things that people suffer in silence and don't talk about. So I think it's a good thing to be aware of and to be on the lookout for these problems, because you never know who's suffering with this.
I don't want to talk specifically about the high-profile suicides we saw, but I'm curious how you reacted to the larger community reaction or the media coverage of these very tragic two deaths. Was this like nails on the chalkboard to hear the way we kind of discuss mental health in our community currently, or did you see something positive coming out of these discussions?
I personally was shocked when I heard about it, obviously, because it was a high-profile one, but not because of being a high profile. You would assume that if someone in that position has had any mental health issues, one would come out and help. And that was a surprising thing to us, that nobody noted that, or if somebody noted the difficulty, it was not addressed properly. And that is usually, unfortunately, what we see with mental health issues.
Does that tell us how far we've got, how real this stigma is?
The stigma is very real, and I think certainly people in public life there's no way they can be honest about what they're going through, which is a real tragedy. I think, on the other hand, I think no matter what the nature of the discussion, the fact that it's on the table, we're discussing it, that's a good thing. Too often this gets ignored, it's under-addressed, underfunded, in both public and private endeavors. So I'm glad we're talking about it. It's a tragedy that it had to happen through the death of some very prominent people in our community.
Has it changed at all when you talk about it's not talked about, it's not funded? That's not breaking news. Has it gotten any better over the last 10, 20 years, or are we still putting these issues to the side?
I think we have made a lot of progress in the field of psychiatry and psychology over the last 30 years in the United States. Psychiatry and psychology in the United States are in the forefront of neuroscience. A lot of research, a lot of money goes to the research, a lot of academic institutions are paying attention to training clinicians. The problem is that either the resources are not enough or there's not enough funding from the state or federal government, and the need is growing. You see more and more people are being affected. The diagnosis is made at an earlier age of serious mental illness. And now we see a cohort effect, meaning that the nature of these illnesses are changing with time. You would not hear about something like autism probably 15 years ago very often. Now you hear that very often. We thought that it was 1 in 80 some people, 1 in 80 kids who were born in the United States would be affected. It's higher than that, definitely. So we're getting more data that supports the increased need for mental health in the United States and obviously all over the world.
And that's an excellent example there. I think the question that comes up is the diagnosis better or is the problem worse?
That's a difficult question.
It's not just specifically in that one area.
Right, no, more broadly, I think a lot of people ask the question. We're hearing more and more about depression, about autism, ADHD, many diagnoses. And I think it's a combination of both things. Some studies would suggest that there have been some increases in the prevalence, the occurrence of these illnesses. But I think also to a greater extent we're talking about them, we're identifying people earlier, more often, and addressing it with treatment. So I think that's one of the positives, is that we are doing a much better job identifying and treating people that suffer from these illnesses. But I still think there's limits. I mean, we're in a time when everything in our society, our economy, is under pressure. And so funding is limited for many things. And unfortunately, this is a sector where people aren't able to advocate for themselves. There are wonderful organizations and institutions, universities that advocate for their needs, but it's still an area where it needs more attention, it needs more funding. There's a lot of people that need help.
Let me just ask a really dumb question before we go any farther. What is the range? What is the spectrum that we're talking about when we use terms like mental health? I mean, I think, for example, I'm surprised that all of a sudden we have autism in this conversation. That may not fit the stereotypical definition of this conversation. What's the spectrum that we're talking about?
I think this is often sort of misunderstood. I think mental health has a very broad definition. We're talking about relatively mild conditions such as phobias, people who fear heights and things like that, to severe conditions like schizophrenia, things that go from childhood, such as ADHD and autism, to dementia in the elderly. So there's a anything that affects the way people think, the way they feel, the way they interact with the world around them, classifies as a mental illness.
I mean, every day we wake up with measuring our energy, physical energy and drive, but at the same time, you have to have some measure of emotional energy and health to be able to deal with your day-to-day activities, to be successful, to relate to other people, to function in your job, to be the person you are in your society. If one doesn't have it for whatever reason, depression, anxiety, phobia, marital discord, so on and so forth, then you're not going to be the person that you want to be in that society. And shows up, sooner or later it's going to show up in your functioning, the level of your well-being, and people will notice that you're not the same person anymore. So you cannot really separate mental health from so-called activities of daily living, basic things.
How do different communities interact with this conversation differently? Or perhaps the prevalence of mental health issues or access to treatment? How do different communities see this issue of mental health differently?
I think that that's a difficult subject, and I think it's something that we're beginning to study probably in the last decade to 2 decades. Their prevalences amongst some illnesses are very similar among. So for example, schizophrenia, to a great extent, no matter what community, what ethnic background, your prevalence is fairly similar. So there are some things that are cross-cutting in terms of how often they happen. But I agree that communities differ in how they react to it. I mean, some communities are more cohesive, they gather around and are more supportive. Other communities really have a hard time accepting a diagnosis or recognizing it, which then leads to not getting to treatment because no one wants to talk about it.
Stigma.
I think we have to be able to identify between the mental health and mental illness. Mental illness, unfortunately, has been stigmatized with the most severe illnesses such as schizophrenia, bipolar disorder, chemical dependency issues, while, as my colleague said, we do have a range of other conditions that are very common on a day-to-day basis amongst all of us: anxiety, depression, mild depression, that we have to deal with every day, and the prevalence is much higher. 1 in 4, 1 in 5 persons in the United States will have some form of anxiety disorder in their lifetime. You have to deal with it. ADHD is fairly prevalent.
How does our insurance come into this factor into this conversation?
So in a number of ways. I mean, in years past, there was a huge disparity in how insurance funded mental health care, which has to a great extent improved, but still there are limits on the number of visits people can have, requirements for extra calls and authorizations for psychiatric treatments, which are often not there for basic medical treatments. So that's improving, but there's still a long way to go there.
The issue is that I think insurance companies mostly are doing a good job to make the service accessible and manage the cost, because if the cost gets out of control, we're not going to be able to have access. The resources, however, are limited. the fundings are limited for public health. The issue of the prevention of the psychotic issues, psychotic disorders, is a very important one. Unfortunately, traditionally, the clinicians have been sitting in their offices or in the hospital waiting for the patients to get sick and then see them and treat them and follow them over years. In mental health issues, by the time that you diagnose a serious schizophrenia or bipolar disorder, it may be too difficult really to change the course of the illness. If you can screen kids, same way that we screen them for vision, hearing problem, speech problem at an early age, we can screen them with rating scales by raters who have been trained, but they do not need necessarily to have years and years of mental health training, and continue to monitor them and find those who are at risk. We would be able to change the course of, number one, mental illness, number two, provide better mental health to our kids, number three, cut the cost ahead of time, rather than waiting when this illness is so serious that it would cost the state, federal government, or insurance companies tens of thousands of dollars per year, aside from cost of the medication, and unfortunately, the disability that we see with those illnesses down the road, a burden on the community.
If I could follow up on that, I think one of the positives that's happened is for those people that do have private insurance through employers, there's been an improvement. Those insurance companies have realized they need to treat this, that there's a huge cost to society, to them as a company, if they don't treat depression and anxiety among people that are working. And so that's a positive. On the other hand, many people with severe mental illness, such as schizophrenia, bipolar, severe depression, to the point where they're not able to work. They're really impaired. And those people then those people rely on free care, state-funded care, Medicare and Medicaid. And of course, when there's limits on Medicaid and the whole controversy around Medicaid expansion, it disproportionately hurts people with severe mental illness that would otherwise qualify for things like Medicaid.
So a lot of talk about prevention in our physical health. Are you suggesting we need a yearly physical and annual mental health checkup?
I would say so. One of the models that under the new healthcare system has been proposed is to have and house a mental health professional in every primary care office to make sure that the doctors who are identifying mental health issues with their patients who come there for physical screening would be immediately referred to the mental health professional for care, so not only to treat the mental health issue, but also the impact of the mental health on the well-being and physical conditions, physical illness. You know that if a patient is depressed, they would not take care of their own diabetes or heart problem or congestive heart failure. These are commonly very costly illnesses in the United States. Cancer patients, all one way or the other, will suffer from depression or anxiety. You have to treat them to improve the quality of life. We will be facing a crisis with dementia, different types, of course. We hear about Alzheimer's very soon, by year 2025. And so we are not really prepared to deal with that issue. Not clinically, we don't have the infrastructure, and I don't think that finances and Medicare funding would be enough to deal with those issues. This comes to be a crisis sooner or later.